Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Deep latch while breastfeeding, benefits and how to do. If you recently had a baby and are starting to breastfeed him, you must know about the proper breastfeeding position. The way your baby takes your nipple into his mouth while breastfeeding is called latching. The better the latch, the easier it becomes for your baby to suck milk. The deep latch technique can help your baby breastfeed easily. It can also help you get the proper breastfeeding position and prevent sore or cracked nipples. How to get a deeper latch when breastfeeding. Hold your breast using your index finger and thumb on the edge of the nipple, forming a C, football, or a U, cross-cradle, shape. Squeeze them together so that your breast gets compressed. Make sure your fingers are kept to the sides as if you are pinching just an inch. When bringing your baby's mouth to the breast, support his head with your thumb on one side near one ear and your third finger close to the other ear. Use the heel of your hand to lift between your baby's shoulders so that his head is slightly tilted backwards. With his head tilted back and chin facing up, lift him to your nipple. The nipple should be just above his upper lip. When your baby's mouth opens, place your breast first into your baby's lower jaw. Next, tilt your baby's head forward and place his upper jaw behind your nipple. When you do the latter, make sure to press your thumb down, forming the flattened sandwich. You can make your baby's lower jaw more securely placed than the upper. Wait a bit, and then release your breast from your fingers. If your baby's nose is pressed against your nipple, tip his head slightly so that you can see his nostrils while the nose is still touching the breast. What are the signs of a deep latch? Number 1. You won't feel any pain throughout your breastfeeding session, save for a tugging feeling. Number 2. Your baby's lower lip will be protruded, like a fish. Number 3. Your baby will suck with a wide open mouth. Number 4. You will be able to hear your baby swallow the breast milk. Number 5. You can see more of your nipple above the baby's upper lip than below. Why should you try the deep latch technique? Number 1. No sore nipples. Sore nipples usually happen from incorrect positioning of your baby during breastfeeding. The deep latch technique will prevent that. Number 2. More milk for your baby. If your baby gets a deeper latch on your nipple, he will benefit by getting more milk rather than just having the nipple in his mouth. Number 3. Prevents breast engorgement. If your baby gets a deeper latch, he will remove more milk from your breasts, leading to less engorgement and better ease for you. Things to remember. Babies have receded chins. If your baby's head tilts forward, he won't be able to get his lower jaw correctly positioned under the areola. This can result in cracked, dry, sore, or bleeding nipples for you and poor milk flow for your baby. You can achieve the deep latch position using various positions like football, cross-cradle or cradle. Breastfeeding should never hurt, but if it does, it's a sign to start trying the deep latch technique. This technique is healthy for both you and your baby.